Good afternoon, everyone, and welcome again to Parentune Live. My name is Nitin, and I'm the founder of Parentune. I'm really excited to be holding today's session because I think it is something to do with timely help on COVID. And today with me, I have a global educator, a global health educator, and an expert, Dr. Sandhya Ramanathan, who's been helping uh, people across the world, across the globe, in various countries, especially in India. And being an Indian, in spite of being in Auckland, she's today with us again to help the Parentune network, the Parentune community. And for that, I'm really thankful to you, Dr. Sandhya. Welcome to the Parentune Live session today.
Hi Nitin, namaste everybody, and kia ora from New Zealand. And I'm really delighted to be here today. And hopefully I'm planning to empower you all with lots of easy to understand tips so that we can navigate this difficult time as safely as possible.
Right. Thank you, Dr. Sandhya, and welcome again. And like you said, I just want to set a context for today's session and what to expect in today's Parentune Live. So what is happening in the environment is that there is a lot of panic, there's a lot of uncertainty, there's a lot of information which is flying from here and there. And today now we realize the true value of verified and validated information. And I'm sure all of you would agree that today with so much of information coming in, it's very important to get it in a timely fashion and to know it before you should know it so that you can use it to keep yourself and your families healthy. Given such times, it's very important to talk to the expert. And in line with that, Dr. Sandhya, who's been working on educating people about COVID and how do you keep yourself and your family safe from COVID, both in terms of prevention and in case you get COVID, how do you go about the whole treatment? So we are going to cover comprehensively right from how do you keep yourself prevented to the point wherein in case you get COVID, how do you keep yourself and your family on a path to recovery? How do you isolate? How do you do that in case of children? How do you do that in case of breastfeeding moms, expecting moms, all of that? So we are going to cover that. And without taking much of time further, Dr. Sandhya, here's my first question to you. If you can help us understand about this whole virus, because it's like you always say, it's important to know the enemy when you're dealing with the enemy, right? So do tell us about it and help us understand about how does this virus work and how does it go about attacking a human health, a human body.
Well, thanks, Nitin, and that's the perfect place to start, which is right at the beginning. And I have this new prop, which I've got especially to help you understand what is it, this enemy that has taken over our lives. We need to understand exactly what it is and how it is infecting our bodies so that we can understand the measures that we have to take in order to prevent getting this infection. So basically, this ball represents what the COVID virus particle looks like, but in a hugely enlarged form. So virus particles are tiny, such that in one drop of seawater, you can have up to 10 million virus particles. Now, the virus particle looks something like this. It's got a protein shell on which it has these little protein spikes. It has an outer fatty envelope, and on the inside, it has a strand of genetic material called RNA, and that's what it uses to replicate itself. Now, alone, this virus cannot replicate, and it can't cause us harm. The only way it can infect us is when we allow it to enter our body. And generally, the port of entry is through our eyes, our nose, or our mouth. Now, what happens when we allow these virus particles to enter our body is these little spike proteins, which are located on the surface, are like little keys. And they are looking for the locks, which are these things called ACE2 receptors, which are quite abundant in the cells which line our upper respiratory tract, so inside our nose, in our mouth, on our eyes, and also in other parts of our body. But this is generally the portal of entry. Now, because we can get these particles on our hands, and this is the biggest reason why we have to wash our hands for 20 seconds well with soap and water, or, singing happy birthday to you twice, is because the point of weakness of this virus is the fatty envelope. So if we destroy the fatty envelope by, washing our hands properly with soap and water, or, using an alcohol-based hand sanitizer that's more than 60% alcohol, then that will deactivate that fatty envelope, and that virus will be destroyed and it cannot infect us. Now, if we do bring virus particles into our body, these little spike proteins find those ACE2 receptor locks, and then it enters our cells and hijacks our genetic material, and that's what this virus needs to replicate. And then we get, each virus particle replicating into, millions of virus particles, which then our immune system has to fight off. And that's why this concept of viral load is very important, and I will talk about that later. So all the measures we take to prevent getting infected are important to prevent infection. But even if you are unfortunate enough to contract the infection, if you are wearing a mask, for example, you are reducing the viral load that you are exposed to, and that will reduce the severity of any subsequent infection. Now, just in terms of why are we seeing mutations, is that as the virus, is allowed to replicate, because that RNA genetic material is not actually as stable as DNA, what happens is, if it's given lots of chances to replicate, then you can get little mistakes occurring in the RNA, like strand. And sometimes, and that's just in the natural history of viruses, this can happen. They can mutate. Some of the mutations make them less infectious, but some make it more infectious. And it seems that the mutations that have been occurring have allowed the virus to increase its infectivity. And that might be through various mechanisms. It could be that it makes these spike proteins stick better to our ACE2 receptors. And in doing so, the people that are getting infected have higher viral loads. And so then that infection is spreading much faster. So the important thing to remember there is that viruses can't mutate if we don't allow them to replicate. So if we all follow COVID-appropriate behavior and we break the chains of transmission and don't give the virus chance to replicate inside our bodies, then we can stop this virus mutating further.
Right. Thanks, Dr. Sandhya, for that. And, tell us a little about this concept of viral load, right? Like you were speaking about it, if we don't let it replicate, or if we can break the chain of replication. But how about, the first time when you get infected, right? If someone, say, for example, if the virus is out there and if I get more viral load, then does it mean that I will be that much more vulnerable to having a stronger case of COVID? Or does it mean less viral load, meaning mild COVID? What does it mean for a person?
I think we will cover that. But first of all, I think what we'll do is we'll just, if you can bring up that little diagram I showed you, that tree, which will help people understand about transmission of the virus, and why this is an exponentially growing number of infections. So I don't know if people have heard this concept of the R0 or the R0, which basically explains how many people generally get infected from one person who's infective. So in this tree diagram, you can see, Nitin, if you show it on the first dot on the left, yeah. So that's your first person who's infected with COVID. And at the initial of the pandemic, they thought that that person could infect 2 or 3 other people. So the R0 was 2 to 3. So you can see that that one person is going on to infect, 2 or 3 other people, and those people are then going on to infect 2 or 3 other people, and so on and so forth, until you have this exponentially increasing number of people who are infected. Now, the only way to stop the infection going from person A to person, B, C, and D, is to break the chain of transmission And in order to do that, you need to, wash your hands. Amen. So avoid touching your mouth, your eyes, your nose. You need to watch your distance. Okay, so at least 2 meters, while remaining socially connected. You need to wear a well-fitted mask, and you need to watch ventilation. And if we don't allow, one person to infect another person, then that, is the way that we can basically, using those three, those behavioral modification, we can bring this pandemic under control. Now, we've got, the good news is that, the real hope in this pandemic is the fact that we've got the powerful weapon now. We've got vaccines. So, yeah, this diagram also shows that, that we're all in this together, that if every single person is responsible for their actions. So if, person, B stays home, for example, then all those people down the track that they could have eventually, been the cause of the infection would no longer be infected. And basically the pandemic will end when one person infects less than one other person. So that, and the only way that's going to happen is when herd immunity is created by the vast majority, probably over 80% of the population being vaccinated. So that's something very important. And I might just quickly explain about vaccination while I've got this little ball. So the reason you're hearing a lot about the spike protein is because this is what all the vaccines are targeting. Okay, so the spike protein, you can imagine it's like the license plate of this virus. Okay, and what the vaccines are doing is they're taking a small piece of genetic material. It's nothing that can modify your genetic material. And basically, what that is doing is you're getting a little injection, and that injection is telling your body this is what this spike protein looks like. Okay. And it's your immune system is like your body's traffic police. And it's saying, hey, when this spike protein or this L plate comes along, I want you to fight it. So what happens is you get the injection, your body mounts an immune response, it destroys that little injection that you got, and you're left with the memory of this license plate or this spike protein. So when the virus, you get exposed to the virus, your immune system thinks, hang on, I've seen this before. I've got to fight it off. Okay. Now, the vaccines, you need to have both doses of the vaccines, and it has to be at least 2 to 3 weeks after the second dose before you have full cover. Now, in terms of the mutations, yes, they are having some effect on the efficacy of, some of the vaccines, because there's a whole range of vaccines that are available globally. Some of them are very highly effective, up to 95% effective, your mRNA vaccines like your Pfizer and your Moderna vaccines. But by and large, what you can imagine is with the mutations that perhaps, some of that L might be missing. Okay, but you can still, your immune system still is getting a good idea. Maybe not quite as clear as before the mutation, but it's still the best protection that we have, apart from, of course, the behavioral vaccine. So, one thing I want to make clear to everybody, because I've already had, a lot of questions, which is the best vaccine? Should I get the Covaxin? Should I get the Biotech? The answer is the best vaccine is the one you can get into your arm as soon as possible. And the worst side effect of the vaccine is when you don't get the vaccine and you are totally vulnerable to, the worst possible outcome from being infected with COVID. Because, we've all heard of young people who've had, bad outcomes with COVID. So at the end of the day, although there are people who are more at risk, when it comes down to it, having a good or bad outcome with COVID is, could be dependent on luck. So that's why, as far as my whole philosophy through the entire pandemic, and when I made, my COVID home management video, it was my disaster management plan, and it was to address the worst case scenario, which unfortunately India is facing again at this hour. And that is, what do you do when you're faced with this infection and you're faced with the terrible circumstances of not being able to access a test by chance and not being able to access hospital level care. So
Right.
as a primary care physician, my emphasis has always been on prevention. Prevention is better than the cure. And when there is no cure, prevention is the cure. So first and foremost, I want to explain to you everything that you should do in order to prevent catching this infection. But if you do get the infection, all the steps I go through in my COVID home management video are targeted at preventing a mild infection from becoming severe. And the good news is we're approaching 11 months since I uploaded that video on June 14th. And I don't think there's been a day that has gone by since in that last 11 months where I haven't received a message of gratitude or thanks from somebody from some corner of the world saying how these simple preventative steps made a huge difference and made them, recover with confidence.
Right. So, Dr. Sandhya, on that, bit on prevention, what's really happening is that the transmission is happening really, really fast now. And in a lot of urban parts of our country, especially across, Delhi NCR, Maharashtra was one state which was affected already very badly. So these transmissions are happening in various ways. So I would like you to explain to us, how does this transmission happen, and how can we sort of take preventative steps on a day-to-day basis, because now it's happening all around us, right? So it would really help us to understand what can we do to prevent ourselves from this transmission.
Yeah, and that's very, very important. So first, I explained, what the virus looks like. So you should be able to, visualize it. You should be able to see, these are these virus particles. This is why I am washing, because I don't want them to gain access to my cells. And that's why, you'd spend 20 seconds or 25 seconds washing your hands, because if you spend 10 seconds, you might have still some, virus particles on your hands that can enter your body. Now, when at the beginning of the pandemic, the main emphasis were on, there were three modes of transmission. It was surface transmission, so they're worried about, picking up virus particles from the surface. And there was all this talk about droplets. So droplets are the big particles that we emit, when we, cough or sneeze. And that's why it was, cough or sneeze into your elbow, and wear a mask covering your nose and your mouth. Now, what has become very evident is the primary and the most problematic form of transmission is aerosol spread. Now, aerosol spread is the tiny particles that we emit when we're even just breathing. And so what people have to think of is they have to imagine that everybody is smoking, that everyone is a smoker, and they're smoking invisible smoke, but you've got to actually be able to visualize that smoke. So I've just got a Glen 20 Dettol, disinfectant spray, just to demonstrate to you what it looks like. So if you can imagine this fine mist that everybody, even if they're just breathing, they're releasing this fine mist. Okay? Now, what happens is that if there are many people in a room and all the windows of that room are closed, what's going to happen as time goes on, those particles are going to concentrate in that room, and that room is going to have a very high viral load, okay? And that concentration of particles of those, COVID aerosols will increase dependent on the number of people. It will increase dependent on the time, and it will increase dependent on the volume at which the people are speaking. So in an enclosed, unventilated space, there is no safe distance. Okay, so that's why I've got this little doll's house here, just to point out that this is actually a very good, a demonstration of the fact that with this doll's house, there's no glass in the windows, okay, so that you can get outdoor air coming in. And now ventilation with, what they say, fresh, flowing or filtered air is very important. So you've got to understand that even if you enter a room where there's nobody in the room, and you say you enter a room and you think, oh, this is wonderful, I'll take off my mask, but you don't know, there might have been other people in that room before. And if it's non-ventilated, the COVID aerosols can stay stagnant in that air for up to 16 hours. And in New Zealand, they actually proved on CCTV footage of a case of transmission in one of the quarantine hotels, that a chain of infection basically started. What they were doing was they were doing the swabs. They would open the hotel, the people's room, and take the swab, and then open the next person's room and then take their swab. And basically there was a 5-minute gap where one person who was infected, their door was open and the next person's door was open. And that 5 minutes was enough for their aerosol to basically stagnate in that hallway and allow the next person to get infected and start a chain of transmission. So now, obviously, ventilation is being carefully looked at, and that's very important, especially if you live in apartments and you've got lifts. It's best to avoid them, or and that's why I want to spend a little bit of time on masking. So actually,
just before that, Dr. Sandhya, when you enter a room which has, let's say, people who you haven't been living in your own house with. Let's say you have guests coming over, or you go to somebody's house or you go outside to get something for your home, right? Let's say you walk into a chemist shop, right? What are some of the things which we could do practically? So one is like what I'm hearing you is, don't take the mask off, not as yet, especially if a place is not ventilated well. It can be even further higher risk, like you said. What can we do? Is masking up really going to keep us safe? What else can we do in such a situation? Not walk into such a room. Sometimes that may not even be a possibility, right? One may have to do that. So what are some of the advice you would go on to touch on? And also if you can talk about masking like you were about to, right? So I think those
well, actually, I think masking is the most important thing for us to cover at the moment, because masking is still our most powerful tool, and it's our personal lockdown, and it's our most effective tool. And you could sort of say, in a way, it's as good as a vaccine for now. And given that we're talking about children, children under 18 are not applicable to get vaccines as yet in India. For children over the age of 2 who can or are happy to wear a mask, then it's very important. One of the things that people have to understand is that with more transmissible strains, mutations of the virus, we not only have to follow the same rules as we were doing before, we actually have to follow them even better. And we have to improve the weapons that we were already using. And the most important one is masking, okay? Because already we were washing our hands, already we were maintaining our distance, but we've understood now that in an enclosed space, there is no safe distance when you're sharing indoor air with people outside your bubble. So I think you've seen countries like France and Germany, when they had these new mutations, they actually mandated premium masks. Now, I think I've got a slide there I've given you, Nitin, if you can bring up, and so people can understand what is the difference between a premium mask and just a normal mask that we were using before. So, yeah, here. So FFP2, this is what's called a filtering face piece. So, our surgical masks and our cloth masks, they're generally just a one-way protection to protect other people from my cough or sneeze. But the filtering face piece, so they're like your N95 masks, or even your KN95 masks, okay? And generally what they have is they have like a wire at the nose, and you can see that they have a much tighter fit shape. And these are designed to not only protect the other person against your particles, they also try and filter the small, aerosols that are coming towards you. So in terms of masks, I mean, you don't have to be fixated on, having an N95. Even working on the fit, improving the fit of your mask is very important. So you can move that and I'll just show you now. You can put me back onto full screen. So I had made a video which you can find on my YouTube, and I'm just going to demonstrate quickly with a simple disposable surgical style mask. So everybody should realize that the colored layer is the outer layer, and that's a waterproof layer. So that has to be on the outside. And the side which has the wire is the top side that molds to your nose. Now, for somebody like me, if I put this mask without doing any modification, see how there's really big air leaks, gaps here and here and here. So this is leaving, allowing little aerosols to come in through these gaps. So there's a very simple trick you can do, which is very good for children, where you take the loops and you tie a knot at the end of each loop. Like so. And then you have the mask looking like this. Then you take these little corners that you've folded here, and then you just tuck them in. And I've got this as a 2-minute video on my YouTube as well. And then you just mold it to your nose and pop it over your ears. And you can see when you put it on, just tuck those folds down. And you can see how I've got rid of the air leak. And this is very good for children. And it's much more comfortable. It's changed it into that sort of duck shape, similar to an N95. Now, I also think, and I have said this even from my first video, that protect your eyes, okay? Because this is another port of entry. And if you can imagine that those aerosols that are concentrating in the room, not only can they enter through your nose and your mouth, they can enter through your eyes. So if you can have a face shield, you can even make something like for children, you can just get a little, plastic loose leaf refill with a headband, and you can make yourself a little face shield. That's do it yourself. But I think at this stage of the pandemic where, there's a lot of spread, as many things you can do to try and reduce your exposed viral load is very, very important. So now, not only do I have this well-fitted mask, the other thing which people do, if you've got a big face and you have the surgical mask, is you can put a cloth mask over the top, okay? And, so you've got the two masks, and that works two ways. Sorry, is that it improves the filtration because you've got more layers, and it tightens the fit. Now, I just want to show you my daughter, because they had to wear masks for school, and all the cloth masks that we bought were too big for her face. So she just took this simple cloth mask that we had bought, and she sewed 2 darts on either side of the nose to bring it in. And then she took a little piece of, drawstring or Nara tape and got a little twist tie wire or a pipe cleaner and sewed it inside. So now you see that when you wear it, again, that molds much better to the nose and avoids any air leak, see? Because you should have a nose, there should be some sort of wire so that you can close it. And that will also, a good clue is when you wear your glasses, if you start getting fogging, then you know you've got an air leak. And the other way to stop fogging of your glasses is to just wash them in some warm soapy water and dry them off, and they shouldn't fog. But wearing well-fitted masks with at least 3 layers, and some masks you can also just sew in a pocket and you can add in a tissue or a paper towel. And it's very important that you take off the mask when you get home, and when you're out, you don't touch the outside of the mask, you don't fiddle with it, you don't pull it under your chin. If you're out or you're seeing people, you only take it off to eat, and that you take it off for a cloth mask. It gets hot washed and dried. If it's an N95 mask, then, get for one person, 5 or 6 of them, and then get an envelope for each one, just a paper envelope, and label them with the day of the week. And so after you've finished wearing it, pop it inside the envelope and then hang it up somewhere to dry. And then when you come back a week later, then back to day one, then you can wear it. And you can do this 5 times, and then you'll need a new one. More important for people who are working in high-risk settings. But, I think there was a question there about people going off to, for appointments or getting their vaccines, and you're worried that there's a lot of, then concentrate a lot on eye protection and face protection. I mean, you can wear gloves, but even by wearing gloves, if you're touching yourself with those, gloves, then you can still get infected. So the masking, the eye protection is key, and also avoiding situations like, if you can take the stairs, avoid the lift, minimize duration of time. If people have to come to your house that are not in your bubble, meet them on the terrace, and, keep the kitchen and the bathroom extractor fans going. Have a sign in your bathroom that if you're going to use the toilet, flush with the lid down, because if someone's infected, that flush if with the lid up will cause a plume of aerosols, which can cause infection. And the other useful thing that people can get, and I think, Nitin, you said that a lot of people in Delhi NCR would have CO2 monitors, because air filters are really good. And you're
air
aiming
purifiers, right? So the what Dr. Sandhya is talking about are air purifiers. The ones who have the air purifiers, you can see the reading, the CO2 reading, and if the reading is going up very clearly, it tells you that, what Dr. Sandhya was talking about, ventilation and the importance of that, and there needs to be some ventilation which needs to be done.
Yeah, so if you have increasing CO2 level, it shows that that room is poorly ventilated, and that you have an increased risk of, being infected by COVID aerosols. So think of it as a viral load indicator for the room.
Right.
So if it's getting above 800, you need to open the windows.
Yeah, I had one question, Dr. Sandhya, which is now coming in. These are questions coming in from all our ParentTune parents. So I would take these 2 questions because they have come in from Akansha, from Shimla, Megha. Both of them are, breastfeeding moms, and babies between 3 to 6 months of age, right? Now their question is, of course, they are breastfeeding their babies. They want to know if they can take the vaccine while they want to continue breastfeeding their baby. Has that got any effect, and should they be worried, or can they go ahead and take the vaccination?
Yeah, that's a great question. But the vaccines have been shown to be safe in breastfeeding, and also in pregnancy, I think in the 2nd and 3rd trimester. Now, initially, I think the Indian Ministry of Health hasn't actually changed their recommendations, but the Indian Federation of Obstetrics and Gynecology has come out with a statement saying that that they think it is fine. So if you speak to your, obs and gynae, and they approve it, and you tell them at the vaccination centre, then it's highly recommended. Particularly in breastfeeding. For pregnancy, you will have to speak to your gynecologist to get that approval. But breastfeeding, they've shown that some of those antibodies actually get crossed in the breast milk and provide some protection to the baby. And we're quite a way off, baby age group children being approved. I think America is about to approve the Pfizer vaccine for 12 to 15-year-olds. So we're still a way off in the younger age group. So, I think watch this space. But just a few days ago, I think the Indian Federation of Obstetrics and Gynae have come out with a statement. So it's just a matter of the Indian Ministry of Health coming along.
We'll take another question, Dr. Sandhya. I'm jumping a bit of
no worries.
steps, but I think this is very interesting. So a lot of moms especially are talking about, Megha has talked about it. I'll just name a few. Amira has talked about it. Amira, in fact, is in Qatar, not even in India. But Ria has asked this. So Priyanka has asked this. They have a common, undercurrent to their question, which is that we have not shown COVID positive in the test, but one of us have shown COVID positive, and the others are showing symptoms but not yet come positive in the test. What would you advise there, Dr. Sandhya? Because then what is happening is that the treatment is starting typically after 4 or 5 days once the test comes positive. Do you think that's a great way to go about it? Wait till the test and then start the treatment, or if there's someone who's positive and if others are showing symptoms, should they start with the treatment?
Okay, so in order to explain this, first I'm going to explain about your bubble at home. Okay, so we all need to try as much as possible to make sure that at home we don't bring the virus home, basically. So you can imagine, I've just got this snow globe here. So we don't want, and this is your home, this is your bubble with your family inside. We don't want to bring any virus home. So we are going to take all the precautions when we're out, and preferably, we're going to shelter the young children, as much as possible. Now, particularly because the situation is out of control, I don't think that it's a good idea for anybody to leave the home unless it's absolutely essential. And definitely children, I would recommend you just keep them at home. So that means that whenever you come in from outside, you need to decontaminate. And so because there is such a high viral load whenever you go out of people that you're interacting, you have to wear your well-fitted masks, but, you have to have a box, just as you enter the door where you take off your soiled clothes, your mask, you dispose of it. With the disposable mask, for example, you can only use it for as many hours before it gets wet. If it's too wet, then you have to change it. Okay. So, keep a few with you, and, wash, your hands and everything very well before you enter the house, so that you keep all the surfaces. When we talked about surface transmission, I remember early in the pandemic, I had made a video telling people how to make up disinfectant solutions in spray bottles, because in order to kill the virus particles on the surface, usually you have to saturate that surface for 10 seconds. So these sort of formulations are good. And again, you can see this video on my YouTube. So have all of this stuff ready. Now, if somebody in your family starts showing any viral symptoms, so I'm saying anything, it can be, fever, runny nose, sore throat, cough, tiredness, headache, stomach pain, diarrhea. Given the current scenario, assume they have COVID and start isolating them straight away. And now what you have to think is that inside my bubble, now the situation has changed and that person is emitting COVID virus particles inside the house. So what you're going to do is you're going to isolate that person, if possible, into one area, and you're going to put a mask on them if they, interact, and all the family members are going to wear a mask inside the house as well. And you're going to try and ventilate as much as possible to allow these particles to, dissipate outside the house. And you're going to be cleaning those surfaces, because these particles are going to rest on surfaces, or that person who's sick is going to, potentially cough and, touch surfaces and get infected. So to answer your question, I think there's an over-reliance on waiting for a positive test result. And if you follow, the steps in my COVID home management video at the outset, and they're very simple things. So there's 3 steps that I cover. And I think what people have to understand is when it comes to COVID infection, just find this diagram here. I mean, there's 3 factors basically in the COVID infection. You can think of it as a triad, okay? So there's me, or the person getting infected, the host, all right? There's the virus, and then there's the environment in which you're exposing yourself to get infected. So as how, your question, Nitin, at the beginning was, about viral load. How can I reduce my viral load or improve my outcome? Okay. Now, the reason I'm trying to explain this as a triad, is that these are the three culprits. Okay. There's the virus that's trying to infect me, the host, and it's the environment which I'm exposing myself to where I get infected. Now, if I'm getting infected in a room or I expose myself to, a loud concert with a huge crowd, or, with lots of people that are not wearing masks, then I have exposed, and I'm not wearing a mask, I have exposed myself to a huge viral load. Okay. But by avoiding these risky environments, by making sure that we're avoiding crowded locations where there's a lot of people talking at loud volumes and there's people outside our bubble, then we have effectively reduced our risk and our potential virus load at any environment where we are exposing ourselves. Do you understand what I'm trying to say? So we have control. We think we can't control. Actually, the good news is there's two things now that we didn't have control of before. One, as I explained to you, if we don't allow this to replicate, it cannot mutate. Number two, the biggest thing is we can get vaccinated. Now, children under 18 can't get vaccinated, but the rest of the family members over the age of 18 can, okay, when the vaccine is available to them. And that is the most important thing. And as we've seen in Israel, just by the now more than 50% of the population being vaccinated over 16, they've seen a drop in the rate of infections of children. So it's very important for family members to get vaccinated straight away. Second is avoiding that. The most important factor, though, is my personal behavior and what I'm doing to mitigate my risk. And the most important thing is building my immunity and my fortress. So not waiting till I get infected. We need to strengthen our immunity now.
Sorry, I'll interrupt you there. I had one question, So how do you go about isolating? And if you can break isolation into two parts, right? One is, like you said, the person who's let's say infecting or is infected, you need to isolate that person, right? Now, one is, of course, showing symptoms. That's the point, like you said. That's the very point that you start with that. You don't wait for the test to come through, because by then it may just happen that everyone else may get infected as well. So how do you go about isolation? What are some of the steps you can follow through on isolating a family member or isolating yourself? And also, is it any different for children when you do isolation, especially in case of, and again, we can cover that separately, in case of babies, in case of children, independent children, right? So if you can talk about steps to isolation, it would be great.
Well, I mean, again, it's a little bit of a difficult one because it depends on each person's circumstances and what resources they have available to themselves, in terms of the space they have at home. I mean, isolation is clearly moving that person into, a fixed area, preferably a room of their own. I mean, if you're looking at an ideal circumstance, you want to have that person having their own bathroom if possible, and them being in their room. And in the case of a child, I mean, if it's a dependent child, obviously you're not going to be able to separate them too much, but at least the carer can wear a mask whenever they're interacting. And if the child is over 2, when they're interacting, you can put a mask on them. And as I said, if ideally you have a separate room, then you put that person into that room and they stay in that room. And their meals and everything get delivered to them. So the way you've got to think about it is you've got to think about that family member is like in a boxing ring and they're fighting against COVID, and the family members are on the outside of the ring offering their support at that distance, at that safe distance, and preferably keeping the house very well ventilated so that, you've got fresh, filtered, flowing air, reducing, whatever viral particles are in that house. Now, remember that person is most infectious early, up to sort of day 10. So obviously, at the first sign of somebody showing symptoms, put a mask on them and get them to sit in one spot. Even if you don't have a separate room, try and even put a little bit of tape on the floor and just cordon, or, you can put curtains, just cordon one area and say, okay, you stay there and your meals will come to you. And, you have to be very careful when you're serving that person. Their cutlery, it has to be washed separately. I said recently somebody I know had it, and it was a teenager, and I said, just put a bucket with water, soapy water, and let them put their utensils in the bucket, and you take the bucket with that soapy sudsy water, and then you go wash their plate and in hot water and sanitize it separately. But so there's a lot of practical things that you can do, but we're looking at whole families getting infected at the moment. So part of being prepared is sort of thinking about how you're going to manage at home. And, it may not be, and as I said, things like, for example, if there aren't more than one bathroom, if that infected person is going to use the bathroom, then make sure that there's a little bit of a gap before somebody else uses it, and you ventilate that bathroom and you clean the surfaces before somebody else uses it. So there are ways, and you have the extractor fans going 24/7 to try and, reduce the aerosols. So there are ways to get around it. You have to understand the theory. So essentially, in terms of with a mother who's, breastfeeding, if the breastfeeding is safe and should continue, if the breastfeeding mother is infected, she wears a mask, she can double mask. She washes her hands, she doesn't kiss or touch the baby's face, and she breastfeeds the baby. She can even express the breast milk and somebody else can feed the baby, but breastfeeding should continue.
Right.
And I think the important thing to remember as well is that there is a lot of panic. The most important thing is to stay calm and be prepared. And remember that 85% of people recover, at home without needing hospital level care. But the problem is, the minute you say that there's no hospital level care, everybody feels like they need to rush to hospital.
Right. So, Dr. Sandhya, one related aspect to this, right, is what if now one gets COVID, right? And let's say you know that you have COVID positive. So there are some things which you need to do once you are COVID positive, and then there are some which can be done even if you're not COVID positive, given the current scheme of things. So I would want to first, request you to talk about some things which all of us in India can do on a day-to-day basis to sort of keep healthy, given the current scenario which is happening outside. Especially related to breathing, the kind of, should we take any supplements and things like that. And then I would ask you about key tips on home treatment.
Yeah. So when I talked about the three factors, so you've got me, the host, the virus, and the environment. So we're trying to avoid the environment where we're going to get infected. Now, in terms of me, the most important thing that I have to work on every day is my immunity, because that's my strongest defense against fighting any infection. And the key things for immunity that you need to keep basically primed is that you need to eat well. And when we say eat well, I'm talking about healthy, whole foods, real foods, not processed foods or junk that comes out of a packet. It's got to be food rich in, fresh, colourful vegetables and fruits, and, preferably prepared at home. You need to sleep well. Okay, so preferably 8 hours a night. Now, part of sleeping well means that we need to have a good routine. We are creatures of routine, and, being in lockdowns and in and out of lockdowns and not going out to a designated place of work makes us feel that, we don't have a routine. We need to make a routine at home, and it's very important for children as well, because this is important for your immunity. So you need to eat and sleep well. You need to exercise. And so, exercise doesn't have to be anything, too drastic. I mean, you can do a short 20-minute workout at home. You can do some yoga. For kids, they can have some fun play. And you need to love more. I mean, you need to remain connected. So all this distancing, it has to be just the physical, but you have to remain socially connected, because loneliness is very bad for your immunity. And one of the good things about, the pandemic hitting at this age is that we have the technology to stay connected in quite a meaningful way with the people that we love. It's not ideal, but it is better than what we may have had before. So that's very important. And the combination of eating and sleeping well and moving and loving more means that we will stress less. And that is key. We need to remove our focus from the outer chaos and channel that energy and just bring it to sort of inner strength and resolve. I mean, by empowering yourself with knowledge, by understanding the enemy, by realizing that this is a marathon, that we can and will survive if we apply that knowledge. And that is what I'm trying to make you understand. So basically, by doing those things, and because if you remain in a state of stress, what happens is that you are activating your, fight and flight response. And that is not good for your immunity. We need to reserve the fighting spirit for when we enter that boxing ring,
Right.
when we are fighting the virus.
That boxing ring example is amazing, and it almost, the way you're talking about it, it sounds almost like a war, which it is right now in India. We are almost like in a war situation. Yeah. So, Dr. Sandhya, another related question to that, right? And this is again coming in from parents, and I'm taking a few more questions in line with that. So one is that Priyanka has asked this. Priyanka, please don't worry. She's asked that I've tested positive yesterday, and but I don't find any of the COVID symptoms, and I'm still positive. And she says that what all precautions do I need to take? I'm of course, in home quarantine, but I'm also a mother of 2 years old, and I live along with fairly old parents. So, both my parents are, senior citizens. So, what are the kind of precautions I need to take?
Okay, so Nitin, you and I got to know each other when you got in touch with me very rapidly after I uploaded my COVID home management plan for home medical management plan for mild COVID-19, which is the 18-minute video which I recorded with my 3-step plan for fighting any mild COVID infection to try and keep it mild. And in the subsequent months, I got that dubbed into many languages so that now it's available in 14 other languages, including most of the major regional languages of India. And you can find these on my YouTube channel. And I still stand by all the steps that I say in that video, and I'll go through with you. So first is that we need to keep our immunity primed, okay? Now, the first sign, so you've tested positive. So what I would start doing straight away is start boosting my immunity by taking some vitamin C and by taking some vitamin D and by taking some zinc, okay? In terms of do we need to take these supplements all the time? The answer is no if you have a healthy diet, but vitamin D status should not be deficient. And that everybody, there's almost universal rates of vitamin D deficiency in India because there's not, much supplementation in food. And also vitamin D is very difficult. It takes longer for darker skin to absorb, and it is actually difficult to get adequate vitamin D. And having low levels of vitamin D was associated with a poorer outcome with COVID. So everybody should have an adequate vitamin D level. In relation to children, when we're talking about immunity, make sure that you're keeping up with their various childhood vaccinations, because you don't want them to have a co-infection with another vaccine preventable disease. So that's the first thing I would do. The second step that I talk about is reducing viral load. Now, the other thing which, when you come back into your bubble, and for, what was her name? Meghna, who is infected at the moment, is I think it's a good idea, because these virus particles that you're exposed to are entering, through your nose and your mouth, and this is an area which is accessible. So when you are entering back into the house, I would make it a habit of rinsing your mouth with warm salty water, or dental antiseptic. There's many different mouthwashes that you can get, or a betadine mouthwash. And that's been shown to have good effect at, deactivating virus particles, and even getting just a saline sort of nasal spray and spraying it in your nostrils. And children can do that as well. It's totally safe. And the other thing which I think is very useful is just getting like a toothbrush and brushing your tongue. Actually brushing your tongue, because the tongue has a lot of ACE2 receptors as well. And I think just any physical sort of rinsing and dislodging we can do of any COVID virus particles that we've taken in. So even if you don't have any symptoms, I still think that those steps of, mouth and nose rinsing that I go through in my video, and even steam inhalation, doesn't cause any harm. It will make you feel better that you're actually doing something. And also, you can still keep it. So actually, I believe that people should make up a kit at home. And you can go through on my description box of my YouTube video where I list all the things that I talk about. And keep a kit ready at home in case you're infected. Because the last thing you want to do when you're sick is run around and find all these things. So a pharmacy here made this box up and, thought it was a great idea. And in there you have your pulse oximeter ready to go, okay, which is very important. You've got, lots of disposable masks. You've got your, saline nasal rinse. You've got your, your Vicks that you can use for steam inhalation. Here we get this a concentrated betadine sore throat, where you can put a few drops and mix it with water and you can gargle it, or you can put it into a nasal dropper and make up a saline nasal dropper and, put a little bit of that into your nostrils, and you can do that, 2 or 3 times a day. You've got your multivitamin with your vitamin. This one actually has vitamin C, zinc, and vitamin D all in one. And you've got your, some balloons, and they should be clean, new balloons, relatively large size, no powder inside. And
so, Dr. Sandhya, while you're talking about this, I think it's a great time to move to home treatment, and especially breathing, right? And if you can now start talking about, let's say, someone gets COVID positive, right? What are some of the management techniques? And, one of the questions which has just come in line with that, just taking that on the screen from Judy, and you can see this on the screen. Judy has asked, can a person who was earlier COVID positive, but is now tested COVID negative in January, could still be a silent carrier of COVID? Is that possible? And she's worried because this person is going out every day on work, like one of the family members who's going out every day on work. So she's worried, of course, for the safety of her family, and she's asked this question. So any advice on that?
So if he had COVID before and he recovered from COVID, then he's not a carrier of COVID. I mean, people, they try and do COVID tests again to prove that they're negative, but sometimes they just keep on coming positive. That doesn't mean you're still infectious. Generally, after day 10, you are no longer infective. But to answer your question, just because you were COVID positive before doesn't mean, and you've recovered from it, doesn't mean you can't get COVID again and then become a silent carrier. Because the reason why, we're in this situation of this, explosive spread is that you have, 50% of people that are asymptomatic, and people are spreading it when they're pre-symptomatic. So people are spreading it without knowing it. And that's why everyone should wear a mask, because a mask protects you, mask protects me, mask protects everybody. If both people wear a mask and one person is infected, you go from a 90% 95% chance of transmission to a less than 1% chance of transmission. And that, you'll be more protected if that's a well-fitted mask and you're also wearing eye, glasses. So actually what you saw in countries that started mandating masks, mass masking, actually had a drop in rates of hospitalization because the people that were getting infected were getting a lower viral load and they were having a less severe illness. So in terms of breathing, so I explained in terms of my video, the 3 steps were boosting, so priming and boosting your immunity. Number 2 was reducing viral load through, your rinsing. And number 3 is, and I think this is key, and the most important thing, which I think everybody should be doing, regardless of whether they've got a mild infection or not, and at the outset of symptoms. And it's good to, practice some of these breathing exercises, even when you're not infected. One of the ones that I go through in my video, the first one, is box breathing technique. Now, box breathing, and I've also got a separate video on box breathing, which is really important in terms of managing our anxiety levels. Because what happens when we're anxious and we're worried about all the things that are happening is that subconsciously we start breathing fast and we start breathing shallow. And that basically changes our gas balance. And it makes us sort of hyperventilate, and that then brings on physical symptoms of anxiety and stress and makes you feel worse. So this box breathing technique, you basically imagine that you're drawing a box as you're breathing. So what you do is you breathe out to the count of 3. So breathe out 1, 2, 3, then hold. And as you're holding that breath, you draw the line down. Then breathe in 4, 5, 6, hold, and then you draw the line up. So basically what you're doing is that one breath cycle is taking 6 seconds, and then you will have 10 breaths in a minute. And so by slowing your breathing, you will, calm yourself down, and you'll bring yourself back into that rest and digest mode rather than that fight and flight mode. And it's important to practice that so that when you start feeling stress coming on, you can sort of switch that on and calm yourself down. So that's something you can do, when you're not infected, so that, we can just try and calm ourselves, and that will help with our immunity. And as I said, that 5-minute demo is on my YouTube channel. Now, to explain what your lungs look like, if you can just show this, and I show this, is our lungs are basically like a big sponge. They look something like this, narrower at the top, and they're on both sides. And you've got these little air spaces, basically. So what I explain is that the most important phase of breathing to focus on is breathing out, or exhalation. Because if you fully focus on fully emptying your lungs while you exhale, you are emptying your lungs of as much carbon dioxide as possible, which means that you will be able to take in as much oxygen as possible. Now, what people normally do is they focus on the inhale, and they're like, and you keep on trying to take this big breath in, but you're not actually getting rid of that carbon dioxide. So I'll just demonstrate here. So I'm going to breathe out first, and I'm going to sort of demonstrate what your lungs are doing. And see, when I take a big breath in, as I showed with the sponge, it just sort of recoils back and the airways open. So what, and basically what happens is that, with this infection, all the fluid and whatever's accumulating tends to accumulate at the base, which a lot of it, ends up being located towards the back. So I think you probably heard a lot about, about proning, and now with shortages of oxygen, things like focusing on breathing exercises so that we forcefully keep these little air spaces open is very important to minimize our chances of needing oxygen. So the first thing is doing proactive breathing exercises, and the other thing is this, positioning. Now, in my video, I explained it using my dog Rani, who these days she doesn't go anywhere without her glasses and her mask. because she understands how important it is to reduce her viral load. Now, you can have the cushion, and this should be done for at least 16 hours a day if you are infected with COVID. And you should avoid back sleeping, because basically, as you can see, if most of the lungs are at the back, if I sleep on my back, if most of the air spaces are at the back, these are going to get squashed, okay? But if I turn around and sleep on my front and not have the pillow under my head, but have it sort of under my torso and just rest, then what happens is the lungs can fully expand at the back. Now, probably even better than that, and is, if you even have 3 little cushions and you put one just under the top part of the chest, one under the hips, and one under the feet. And what that does, or you can do, Nitin was showing the picture of the child's pose, which is, a pose in yoga, where, as you can see, there's no pressure of the bed or the pillow at the front nor at the back. And this is a very comfortable pose for you to sit in. And even if a child is infected, you can get them to, it's quite natural for them to sit in this pose, and you can give them a little book or, coloring or something, and get them to sit like this. And you can get them to do some simple breathing exercises. Now, I talk about balloon blowing, so that's good. Another very simple one is blowing bubbles in a cup of water. And what you're basically doing with the balloon blowing, and also with this, is you're forcefully, you're sort of incentivizing your exhalation. So you're exhaling against a resistance. And that is good because it helps keep our little air spaces open and prevent them from collapsing. So, and if you try to breathe out without an incentive, and because yoga pranayama is fine to do if you're well practiced at it, but when you're sick and you don't have as much energy, it's nice to have something as an incentive to do, and it's very good for kids. So I'll just demonstrate, for example, with this. See, I can keep on blowing bubbles, but if you asked me to sustain holding a breath out for that long, I wouldn't be able to. And it's same with the balloon, and you will notice that your oxygen saturations will go up. Now, in terms of, it's very important that people understand how to use a pulse oximeter. So the pulse oximeter basically shines a light. It has this little light, and you can use any finger, but there shouldn't be any nail polish on your finger, and your finger should be warm. The finger pulp has to go all the way till the end so you can see the light shining through. And then, you just wait for the reading. And one of them is your pulse rate, and one of them is your oxygen saturation. Okay, so at the moment it's saying that my oxygen saturation is 99, so that's fine. So the normal range is between 95 and 100. Now, another point I'd like to bring up when we're talking about, how do you keep yourself prepared? Now, if you have a chronic condition, it's very important that you, like diabetes or, any, immune suppressed condition like a rheumatoid arthritis or anything, please keep taking your medications and, keep contact with your doctor and keep on top of those chronic medical conditions. And it's probably a good idea for everybody to get an idea of what their usual oxygen saturation is, because yes, healthy people normally have oxygen saturation range between 95 and 100, which is normal, but other people who have chronic lung disease, for example, they might have a resting lower saturation. So what you want to make sure is that if you are infected with COVID, that you are wanting to see that if there is a drop of, like 4% of what your normal reading is, then you know that that's a warning sign and that you have to go. Obviously, like in my video, ideally you don't want your saturations dropping below 93 and you want to be getting medical help because of the situation where, things are, the resources are limited. These exercises are extremely crucial. So, the other person who has no symptoms, if it was me and I had no symptoms, but I had a COVID positive test, then I'm going to be doing all of these things for 14 days.
Right.
I'm going to be making sure that I'm totally fine, because the whole reason I talked about pulse oximetry is because the pathology in COVID is it causes a silent hypoxia. So silent hypoxia means that what happens is that people's oxygen saturation drops, but they don't show the symptoms that you traditionally see of shortness of breath, because the pathology is different. I think it's, microclotting. So
Right.
what happens is basically, because it's a silent hypoxia, if you are not measuring your oxygen saturation, and this is what they noticed in New York, people were coming in and they were still talking on their phone. And the people, the doctors were shocked that they were having really low saturations in the 70s. They're like, how is it possible that they're talking? And that's why it's important, because you don't want to miss a silent hypoxia.
Right.
So if you follow these steps and you're checking your temperature and and your pulse and your pulse oximetry, and it's all maintaining, then you don't need to run and go get a CT scan the instant you get a positive COVID test. I mean, that's exposing yourself to unnecessary radiation. And the other thing is, there is a lot of cocktail of medications that people are being prescribed, which may or may not be helpful. They are not recommended in children, particularly under the age of 12. Children, the only medication that you need are simple, over-the-counter, symptomatic treatments, the most important one being paracetamol. Understanding that, why do people have fever? Fever is our body's way of fighting infection. So by raising our body's temperature, we make it an unfavorable environment for bugs. That's why we have fever. But it makes us feel a bit miserable. In young children between the age of 1 and 5, that are certain susceptible children, a rapid rise in fever can cause this thing called febrile convulsions. But that's usually, you would know if your child was going to have that and you have a family history. And that's why they tend to bring fever down. But, if somebody has a fever, because I've seen questions like, even day 10, I've got a fever, it's okay. As long as it's not a persistent high fever and, the person is not getting confused or showing any red flags, shortness of breath, dropping oxygen saturations, confusion, persistent headaches, rash, signs of a neurological deficit like a stroke type thing, then, if everything is going properly, then you don't have to worry. Just keep on following. I mean, you can do the breathing exercises every hour, once an hour when you're awake. By having a plan to follow, it will help calm your anxiety. And keep a little diary, chart it. And and the other thing is, the minute you are worried that you are COVID positive, even if you can't access a test, talk to your doctor or get some virtual medical help. We've just launched even overseas doctors grouping together and via an app, just like a second opinion, just somebody there that you can ask, look, I'm worried. And it's great. People are already logged on, and we're just saying, yeah, no, look, it's fine. You're okay. But if there's any red flags, we're telling them, go off and seek some help.
So, Dr. Sandhya, there are some more questions. What we'll do is, there's about 5 to 6 minutes more.
Okay.
So we try and capture most of the questions. But one of the questions which is coming in is persistent fever, on day 6 and day 7. So that's one line of question, which is, what should they do when the fever is not going down? It's coming back again and again. And especially this has been mentioned in day 5 to day 10, anywhere in between, in most of the questions. So this is one question. And the second is, what should be the first line of treatment, or what should be the first few medicines which someone should take in case they are showing COVID symptoms? So these are two questions which are coming in different ways from a lot of parents. We can first cover the persistent fever, and when should you really get worried? Is there like a temperature degree when you know that this is like really not good, or is it when it is reoccurring in a certain interval, and what should you do?
Like, as I just explained, fever is the way our immune system fights infection. So persistent high fevers, when they're associated with the person, feeling very unwell, you can, talk to your doctor and get advice. But, even between day, I mean, I think this virus works in very weird ways. And some people with long COVID that persists over 3 weeks can also get recurring fevers later. So within the first 14 days, sometimes some people, their fever settles, and other people, it seems their fever continues. So you have your symptomatic treatments, you've got your paracetamol or even ibuprofen. You can take either or, and make sure that you're taking the adequate dose for the weight, whether it's of the child or, of the adult. So often people will say, I had fever, I took just one paracetamol tablet. Now the adult dose is, 1,000 milligrams. So it's, or I think in India they have 650 milligram tablets. So make sure that you're taking adequate dose. So not taking an adequate dose won't bring your fever down. And, you can, use your, sponges or whatever. But fever per se is not a cause of concern unless it's a persistent high fever. Again, and it's associated with other red flags. In terms of treatment protocols, in the ones that I recommend in my video, I still stand by. I know that in India there are a lot of, local treatment protocols, and you're best to consult your doctor to find out exactly which one. Whether they make a difference or not, is debatable. But in certain groups, they definitely have to, get started on things like steroids and blood thinners, depending on the severity. So you need to get. The other thing which I just wanted to mention is, and for kids and for part of your, your kit, is stock up simple symptomatic treatments. Like antihistamines are very good, and they're simple tablets, and nasal decongestants. Like you can get nasal decongestant sprays. If you have a running nose, not only does it drip forwards, it drips back and causes a tickle in your throat. That's called postnasal drip. If you can dry up that postnasal drip by using a nasal decongestant spray, or, a phenylephrine tablet, which often in India comes in combination with an antihistamine, then you can help, prevent getting a cough. So those are simple things. Another thing which can be quite useful is having a little spacing device at home, and just, your salbutamol or your Ventolin sort of puffer. And now they've also got the steroid puffers. They're saying for some people that's also quite useful. And interestingly, early on in the pandemic, a lot of parents or people who are asthmatic were quite worried. Oh my God, how am I going to be? But the asthmatics did quite well, and they didn't have a poorer outcome. And perhaps it was because they were taking these sort of puffers. Now, the reason I want to bring this up is, through this, portal where we've started consulting the patients, what I notice is a lot of people in India like using a nebulizer. Now, nebulizers is another aerosol generating device. And if somebody's infected in your house, it's better that, if you've got a spacer, these are available and they're cheap, it's preferable that you use a spacing device. And it's good, normally we give them to children. And if, even if your child is got a bit of a tightness of, a cough or asthma, you would know that all you do is, even if for a child under 5, it comes with a little mask, or a child under 3, but otherwise you can just put your mouth on the mouthpiece and
Right.
you just take. And these are useful because I don't think people should be trying to nebulize too much in the house with COVID, because that will spread aerosols.
I think that's really helpful. And, there's one last question, and I think that is the last question which I really want us to cover, because this is like unseen and first time, very scary kind of a, surfacing situation now for parents. And I'm talking about MISC. And what MISC essentially is multiple inflammatory syndrome. And this is happening because of, a post-COVID kind of an effect after someone has had COVID, and in some cases in asymptomatic, folks. And now this has surfaced in a few children. And Dr. Sandhya, I wanted you to talk a little about MISC and tell us first and educate us, what is the syndrome? How can we look out for it? Because what's really scary is it's now surfacing in children who've gone through COVID, and somehow there are no visible symptoms. So, how can we deal with this, and what would you advise us on this?
Yeah, so MISC or is multi-system inflammatory syndrome in children that was noted, associated with COVID, and it's sort of similar to a post-viral syndrome called Kawasaki syndrome that's been, that we've known about before. Now, it's important to realize that the incidence is pretty low. I think in a place in the US, I was reading that they had about 2 cases per 100,000 cases in children under the age of 21. Now, this can happen even if your child has had an asymptomatic COVID infection and you didn't even actually know that they had COVID. And the signs to look out for, and the good news is it is treatable if it's picked up early. So because the reason you're seeing more of it now in India is because although the proportion of the number of children that are affected as a proportion of the whole, population that's infected, proportionally as a percentage, it hasn't increased. But because the quantity of people that are getting infected has increased, you are seeing a lot more children infected. So you will see more of these cases. So the things to look out for are, a persistent high fever, so you're saying over like 100, lasting for, several, 24 hours or more. Abdominal pain, persistent abdominal pain, diarrhea or vomiting, neck pain, neck stiffness, rash. When you look at a rash on a child, you generally the rashes which are blanching, which you press and then the skin, it goes white and the rash goes away. They generally are, they're okay. Rashes that you don't have to worry about. The rash which you try and blanch and you press on and it doesn't go away, that represents like a little, like almost like a bleeding point under the skin, and that's a warning sign, that you need to seek medical help straight away. So any unusual rashes, any red bloodshot eyes, shortness of breath, chest pains, bluish lips, child becoming confused. Obviously, you're going to know, but I would just, make it a habit of, just scanning the kids quickly, if they're young kids when you're bathing them and making sure that they're fine. As I said, it's a good idea to just make sure that you, check everybody's parameters. I think we know that what, your general temperature, your exercise tolerance, they're talking a lot about this 6-minute walk test and seeing whether, you have a drop in your oxygen saturations after doing this 6-minute walk test. Of 4% is a sign that you need to seek medical advice straight away, medical help straight away. So I think overall, I would say also with this MISC, that's why, despite the fact that children generally have a mild course, and first and foremost, we've got to protect the children. I just want you to show that rainbow image quickly, because I did this talk for National Institute of Disaster Management, and I tried to explain that, we have to think of this pandemic, as I said, is I think it was right at the top. It's a marathon, but I just came up with this image to try and help parents understand that if we think of the children that we're trying to protect under the protective bubble under the rainbow, okay, and the different bows of the rainbow, the arches of the rainbow represent the layers of protection. So each arch, I've written the words underneath of hands, face, space, and replace. So when we talk about hands, we're talking about hand hygiene, so that wash your hands, amen, avoid touching your mouth, your eyes, your nose. With face, we're talking about wearing a well-fitted mask and, preferably eye protection. And for space, we're talking about keeping our distance while remaining socially connected. And for replace, we're talking about ventilation, making sure that wherever we are exposing ourselves, that, there's fresh, flowing and filtered air. And overriding all of this, I've got that, through the, Indra Dhanush, through the, rainbow, I've got that vaccination, which is hitting the COVID virus particle. And that, family members that are applicable need to get vaccinated as soon as possible, and eventually children will also get vaccinated.
And that,
and the basically what we are looking for is to get to the end of the rainbow, to that elusive pot of gold, which is the end of pandemic. And we will get there, but we have to learn to live within these parameters. And the reason it's multi-layered is because no single layer is foolproof. So it's just like Swiss cheese. We have to layer up, and layering up our protection levels. Not only are we avoiding catching the virus, we are reducing the viral load that we are exposed to, which will reduce the severity of infection should we get infected. If we do get infected, we are going to follow all the preventative steps which I have outlined. It's summarized in my video, available in all the major languages of India. Please watch it. Please share it. It has saved many, many lives around the world and will continue to. But please stay positive and stay safe. Try and shut your mind from the external chaos and focus. We still have to keep living.
Thanks, Dr. Sandhya. I think just on time, and your entire demonstration of how we should essentially fight this enemy, the COVID-19 enemy which we are facing, and how if we follow these steps we can not only stay protected if we don't have COVID, but in case we see the enemy close on, then how do we live the enemy and then make sure that the enemy is out of our houses sooner than later. Yeah. So I think beautifully explained. Really enjoyed the conversation as always. We had a lot to cover, and I just want everyone to know that we actually have not been able to cover some of the things. I can tell you that there were more images, there were more illustrations which we wanted to take all of us through. But I think we've done a good job today, Dr. Sandhya, of talking about what you have essentially helped us understand is.
Actually, if anybody wants any more of that information, please follow me on my Instagram at Dr. Sandhya_Ramanathan, or on my public Facebook page. I have kept all of these things as a public resource so that you can access.
Right.
And if you're worried that you missed anything, it's all posted, all my videos, all my content, and also on my YouTube channel, but particularly on my Instagram. If you are on it, all of these diagrams are there.
Thanks, Dr. Sandhya. So with that, we would essentially, say thank you to Dr. Sandhya. Thank you again, Dr. Sandhya, for all the help. Namaste from all of us in India. And, thank you again for helping us. Looking forward to more such sessions. And, hopefully we'll be able to go ahead and all of us will stay safe. Thank you again for joining, everyone. We'll be back again tomorrow with a live on how can you help your child during the pandemic. Children are at home. So how can you help your child to write better, and how can your child find interest in writing, being at home and these times. So thank you again, everyone who joined in. We hope this helped you. Thank you again, Dr. Sandhya. See you guys.
Thank you. Namaste, everybody. Stay healthy and stay safe.